since the last time we met. And the reports were also clarifying the problems or the issues that have been reported in the media, which mainly were purely issues of miscommunication and misunderstanding. And these are things that we have clarified and put to rest. We have discussed the report from the investigations that we have done and what are the recommendations. And we also received a report from the Human Rights Commission Commissioner, who also gave the report. And we then agreed on a way forward. We are hoping, like we said last time, that we are going to conclude the matter in 60 days' time, and which we are going to conclude it, and we are in the process of doing that.
Let's maybe break it down for our viewers. One of the concerns raised by this family was the fact that the promised counselling for Martha Marais hasn't been forthcoming. In fact, speaking to the spokesperson, telling us about how the Gogo is quite traumatized and she hasn't been receiving any counselling. In fact, authorities are expecting her to go back to the same hospital where she was violated.
Not necessarily that she had to go back to Mamelodi. I think we did make an undertaking that counselling will be done, and I think they did. First, there was one session that was done, but there was a couple of misunderstandings in terms of times and also in terms of what actually needed to be done. But one thing also that we also stressed here is that there are things that when things were not done, they were supposed to have communicated the information to the MEC or to the office itself, so that we can be able to ratify it. Because the undertaking that I made was that if things are not done the way we have agreed, we then have to be able to get in my intervention in. And that this is something that, as I said, it was a misunderstanding and miscommunication, and we could have actually rectified it. Part of the way forward is that we are going to have counselling continuing, and we are going to make it, and it will be done here in the house, not in the hospital.
The last time we spoke, you said that 4 officials were suspended at the time. What happened to that process? How far is the suspension? Do we know who these people are?
Don't rush. The issue is that the process is continuing. Remember, what normally happens is that investigations get done, and then there are recommendations that are made. So now we're at the part where recommendations were made. We know the individuals, and we can't divulge the names because we have to protect their confidentiality and their identity. And we are going to then get a complete process which the labor relations officials and offices will be able to deal with. Then we can give a comprehensive report of the consequence management that was done.
Can we expect the department to lay any charges at this point?
What charges? Just be specific.
There was a violation of human rights here, Mr. Masuku.
Yes, the human rights person is here who can be able to respond to it. Let me deal with what is important, which relates to the health and the outcomes and the consequence management that deals with it. And
but who was in charge of overseeing that Mrs. Marais would get counselling?
Yes, remember that the department also, I will also help you that the department is also divided into districts. So the district health authorities around here, which are responsible for Tshwane, we're supposed to make sure that all what we have undertook that happened do happen. And it's not like everything didn't happen. It's just that it was incomplete and it was insufficient, and we still need to do more, and we need to complete it. So
but it was 30.
Pardon?
It was 30 days, MEC, that Martha Marais is supposed to receive a level of counselling. From my understanding, she only had one visit from a psychologist, and that was it. So if you're saying that there was miscommunication and, various departments were not able to do what they're supposed to do, surely hits should roll.
I'm not sure about that. If you don't cross live on time, I'm not sure if the media will punish you and say that heads must roll. But what I'm saying here is that it's not only one session that happened. There were several sessions, but comprehensively, and what was expected is not what was given. And there were some miscommunication in terms of dates and times and appointments. And those are things that we need to sort out and make sure that they do that.
Consequences with regards to this. Ms. Marais is really repeating what had happened to her, clearly showing the extent of the damage. And we can't say that there were miscommunications, overlooking the fact that someone is traumatized from the experience that they had at the hospital.
You are saying we're overlooking it.
And we can't equate this to media, of course.
We are not overlooking it. No one saying it's overlooking it, and we are going to do it, and we're going to go it comprehensively.
How?
I'm not sure how you say how. You want me to explain how the process of counselling happens?
You have delayed it, Mr.
No,
Masuku.
Not necessarily.
It has been delayed, and you're coming back and you're saying you're going to do it again. Do you think this family will trust you this time?
They should. It's an open relationship that we have, and it's an open relationship that we have established. And we are here to ratify that the counselling was not sufficient. That's what we are saying, and all of you, we agree that it was not sufficient, but counselling was done and not complete. And we are going to continue and do a comprehensive one. And we are going to make sure now from my office that counselling does happen.
Do you have time frames of when it will start?
Unfortunately, counselling won't have a finishing time.
Do you feel that you've let this family down?
Partly, yes, but I think we are in the process of correcting that.
Let's speak about the other hospitals that are facing the same challenges. The Premier has pointed out 5 of them and says you need to attend to them. One of them being Mamelodi Hospital that has let Martha Marais down. What are you going to do to remedy the situation there?
The Premier said we must sort it out, and when we were here the last time, we did undertook that there will be processes that will deal with the challenges that we have identified. And most of the challenges are general challenges that we see in most of our hospitals. The inadequacy of the infrastructure is one of them. Before the SOPA, the Friday before the SOPA, I brought the Premier as one of the roadshows to show him the space where we need to expand the casualty, which we are going to do. We also spoke to the staff members and the staff agencies to make sure that we're going to be able to increase the staff. And these are things that we are going to sort out. With Mamelodi, there are a number of plans that are underway, which we are going to unveil with partnerships that we are going to establish. So for Mamelodi, it's not something that we still have to go and do. It's something that we now have to implement, because planning is not within the range now. We are now at the point of implementing to correct the situation that we were in.
MEC, while we have you under the spotlight, are you able to maybe take us through the statement that you've sent out with regards to the security at our hospitals in Gauteng? Just tell us in terms of following several incidents at several hospitals, what are you going to do to ensure that, staff, nurses, even patients are safe going forward?
Yes, I think we are. I think the most important thing is to ensure that the service does continue. We need to secure the service. And we have met with the police service in the province, the deputy commissioner, and we have a plan that we have derived, which involves them also as the police being involved in the whole policing thing. And as you see in the statement, we have engaged in a process where even the patrolling and the regularity of the patrolling of the police, particularly in the sector area, will be done with regularity, and also with where they can be able to sign in and sign a register just to make sure that it does happen. We also spoke about the patrollers, the community safety patrollers, which will be involved and integrated in the process. In a way we don't have patrollers who are going to involve the reservists, That's one part that involves the police. And we also formed a committee which we didn't have, which we call it a priority committee, which is going to be reporting directly to the provincial security cluster meeting, which is held once a month, which will be the one that will then, in terms of priority and in terms of incidences, will be one that gives us that cover. The other part that we have done is the issue of the service level agreements with the contractors that we have, which usually has not been followed to the T. So part of it, and part of the committee's mandate, is to make sure that gets enforced in terms of metal detectors in our hospitals, in terms of pepper sprays to try and dissuade people from coming in, key and lock in terms of butlers to make sure that everything's set. But the one other important thing is to also have panic buttons, which will make it easier for police to be able to be alert and it will respond in time. So these are things that we are going to put in place, and we are going to make sure that these security companies and contractors that we have actually abide to it. The last one is the issue that we have to engage in, which is a community mobilization, because the community are the ones that destroy the service. They are the ones that destroy the clinic, and we have to make sure that even our staff and everyone is safe, and the community should be able to protect such people and protect health workers and protect the service, because they will need it at some point.
Let's hear now from the Human Rights Commission on the agreement that has been reached with the family and the Department of Health, seeing that you said before that you would be going for compensation. Tell us about the agreement.
Well, at the moment there is no agreement in place. We are still in the middle of discussions with the Department of Health, and we hope that in the end we'll be able to secure appropriate redress for Mrs. Martha Marais.
You mentioned that you'd be able to secure appropriate redress, but what is appropriate redress in this instance?
Well, we are looking for compensation. We are looking at a number of things, and holistically, issues pertaining to infrastructure, staff attitudes, availability of healthcare, waiting times. So our approach is more holistic, but we want to ensure firstly that we address this issue, and we will soon be convening a mediation session with a view to amicably settling this matter, because we've agreed that we should not adopt an adversarial approach, as we think that we all agree that her rights were violated, and we look at a number of things in the agreement where we've raised a number of issues with the department concerning training of health professionals, issues regarding refurbishment of health facilities, and prioritization of vulnerable groups. It's one of the things that was raised earlier this afternoon when I had a meeting with the head of the department, and we are hopeful that within the next 6 weeks we should have settled this matter if things go according to plan.
Are you able to tell us how much you're looking at here, and whether the Human Rights Commission is willing to settle out of court?
We are willing to settle out of court. We are permitted by our own act to utilize alternative dispute resolution mechanisms to settle disputes and to secure and vindicate the rights of people who are victims of human rights violations.
How much?
Well, it's not really about money. It's about restoring her dignity. It's about securing her rights. And it's also about the broader transformation project that we are embarking upon as a Human Rights Commission in order to ensure that Gauteng becomes the beacon of hope when it comes to health in the country.
Do you think that the Department of Health is genuinely concerned about the issue of the vulnerable groups? I mean, given how long it has taken them to respond to the situation?
Well, genuinely, I don't know. But I can say that we have a commitment from the MEC that the department will provide the required assistance, and we will continue to monitor the department to ensure that they carry out and fulfill some of the commitments that they've made to the Marais family.
Are you satisfied with the reasons they've given you today?
Well, that was Wang Jones from the Human Rights Commission giving us his view in terms of the right measures of restoring the dignity of Martha Marais. And obviously, before then, we heard from Gauteng Health MEC Bandile Masuku as he visits the family of Martha Marais. It's a story